Hi, I'm Dr. Patrick McGrath, and I've been treating OCD for 25 years. How am I that old? I don't understand. Anyway, today I'm going to answer the OCD questions that you have given us from across the interwebs. Now, maybe you have questions I don't cover here, and if you do, well, join me on my Wednesday night webinar where I answer OCD questions from people all over the world. And sometimes I don't get to everything, though we took some that maybe we haven't been able to answer yet, and we're going to start talking about them in some of these short videos. With that, let's get started. Question 1. When I don't feel anxious about triggers, I feel like I faked my symptoms and got misdiagnosed. How do I stop this? So here's the thing. OCD is going to get you to doubt everything and even things about treatment. OCD will interfere with OCD treatment, okay? So now what's going to happen? You have these triggers that you've experienced in your life, and they've made you really uncomfortable or anxious or full of shame or guilt or disgust or whatever it might have been. OCD is not limited to anxiety by any means. And today, maybe you have one of those triggers and it didn't feel quite the same. And now OCD will say, oh, didn't feel the same. I wonder if that means it doesn't bother you as much as it used to. Maybe that means you're liking it now. Maybe it means that you want to do those things. Ooh, terrible person you are. Maybe you should stop this therapy because it looks like they might be trying to get you to be okay with this stuff. Well, in some ways, we are trying to get you to be okay with things, but we're not trying to get you to be okay with doing the stuff that pops into your head, whatever those obsessions are. We're just trying to get you to be neutral to the fact that you have obsessions. Anybody could have intrusive thoughts or images or urges. I have treated so many people with OCD that I've absorbed many of them myself. In fact, I'm sure you're a nice person, but if you and I were on a staircase together, I'd probably think about pushing you down the stairs. And the reason is I've treated so many people who are afraid of what if I were to push people downstairs, and I've done so much work with people on staircases that to this day, I can no longer take stairs without contemplating the death and destruction of everybody on stairs. And guess what I've never done? I've never pushed anybody down the stairs. It isn't about not having the thoughts or the images or urges. And it also isn't the fact that you must always feel bad about them. No. You can absolutely feel neutral about things, and there is nothing wrong with that. That is the goal that we're trying to go to. You can handle whatever it is that pops in your head. Here's another question. I'm obsessed with strangers' problems instead of solving my own. I'm not sure if this is OCD or not. I don't know. It's hard to say, right, without knowing more about you. But here's something that I can tell you that could be a distraction. Right? And there are safety behaviors that we often see in people's lives where people will go to things like avoiding anything that's uncomfortable, seeking reassurance from everyone they know that everything will be fine or okay, distracting themselves and focusing on something else instead of their own things, which sounds like that might be what's going on here. People might use substances or alcohol as a way to just get high or drunk and not be so focused on the intrusive thoughts and images or urges. And with OCD, you do compulsions, mental or behavioral acts to try to neutralize whatever the obsession is. Now, there's another piece in here where you say you're obsessed with strangers' problems. Sometimes we overuse the word obsessed, and I'm always concerned about that because to me, I'm a bit of a purist. I talk about an obsession as an intrusive or unwanted thought or image or urge that is neutralized by a compulsion. But sometimes we'll say, well, I'm really into or really interested in or I'm quote unquote obsessed with these things. It's not quite the same definition that we use for obsessive compulsive disorder. So I'm always wary when I hear people talk about being obsessed with something or having to compulsively do things when it's not OCD. What about things you did wrong in real life that become an OCD topic? They happened. Well, let's first talk about a couple of things here. Wrong. OCD picks a lot of things to be wrong that most people wouldn't say are wrong. So I don't know that something was actually wrong or not. I'd have to get very individualized into that. But let's say that you did do something wrong. And is there anyone out here who hasn't done anything wrong in their life? Just if you have, write me an email. I'd be really interested in interviewing you. But otherwise, all of us have done something probably considered wrong at some point in time in our life. It happened. I will now ask you some questions. How much should one be punished for that thing? What is the level of punishment required? Let's say you did not hold the door open for someone, and when you let go of the door, it hit them in the foot, and they said, ouch. Would a appropriate punishment be now you must hold doors at that store for 27 days in a row in order to make up for something that you did, right? When we get into OCD, though, there's a fuzziness. People will tell me about all these things they did, quote unquote, wrong, when what we really seem to discover is they're worried that they might have done something wrong, but they're not really sure, and they'd like someone else to confirm for them whether it was wrong or not. So I'm not here to judge anyone's past actions. If you did something in the past, well, OCD will really want to grab onto that and use that as a way to really compel you to do compulsions. OCD will say you must make amends for those things. And the best way to do that is to do all these compulsions. Maybe it's beat yourself up to attempt to be better. Maybe it's to go back and find anybody that you might have wronged and somehow make amends to all of them. I've even seen people looking up in newspapers, people in a town that they used to live in to see if anything had happened to them that they could somehow relate to something they had done decades earlier, right? I don't know that we would suggest that to most people. And one of my go-to questions is, would you tell a best friend in a similar situation to do the exact same thing you're doing? And the answer is typically, nope, not at all. Would not do that. And if that's the case, why do you need to do it? Or is it being driven by obsessive compulsive disorder potentially? OCD is going to take it to a level beyond what anyone would ever suggest for anybody else to do. So if we've done something wrong, is there an opportunity to make amends? There always is, potentially. And could once be enough? Yeah, right? And if we can't find the person, is that okay? Yeah, that's all right too. But not to OCD. Because OCD is always going to say, yeah, but you need to do more. You need to do more. This thing did happen, and you'll always have to do more. And we have to recognize that the doubting disorder, or as OCD is called, which loves the what ifs, is always going to jump to the worst case scenario. And do you have to believe everything OCD tells you? Absolutely not. And are people with OCD feeling better by doing all of these things to try to figure this out? No, they are not. Keep this in mind. If OCD was really helpful, my job would be to give OCD to people instead of help reduce the impact that it has on people's lives. If someone came into a session with me because of what we're talking about here, the idea that something wrong happened, I would work with them on accepting the fact that they're a human being and that we do wrong things, and that it is okay to move forward in life instead of listening to what OCD wants, which is only to punish and punish and punish. And I could say that 27 more times. Just punish, punish, punish. There will never be enough. Another question that's come by, how does OCD affect your dreams? I don't know. I mean, there's so much debate around dreams and how they work and what they are. But what I can tell you this is OCD can be affected by dreams. That I will definitely say. Because people have had dreams about things and then punish themselves while they're awake because their OCD will tell them, not only should you not think that or have that image or urge while you're awake, you shouldn't even have it while you're sleeping. So you're a terribly awful bad person and you need to do compulsions about things that you've even dreamed about. And then people can get really caught up in trying to remember, did I have a dream last night? What was it about? What if it was about this? Maybe I should do compulsions to neutralize it just in case. And they don't even know if they had the dream, but they're going to do compulsions anyway, just to be sure. Of course, during the day, if you're so focused on something, it's not uncommon to have dreams about it. And that might be one way that OCD can affect dreams, because the more we try not to think of something, pretty much the more guaranteed we are to think of it. And not surprising that that would even come up in your dreams also. Sometimes we get asked, how is ERP different from testing? Testing is really a situation where you might slightly dip a toe in the water, but pull it back right away and not allow for a full experience. Versus exposure and response prevention therapy is going to be to put a foot in the water and keep it there until you learn that you can handle it. So lots of people will say, well, I tried that, but it didn't work. When the reality is, I don't know that they really tried it. For example, let's say, well, I touched the doorknob and I didn't get COVID. Well, maybe the doorknob touch was like this, boop, and that was it. And they can attribute it to, but it was so fast or it was luck, and that's the only reason why. Versus if you're working with me, I want you to hold the doorknob until that discomfort goes away on its own without doing something to make it go away, like not doing avoidance, reassurance, distraction, substance use, compulsions. I want you to stay in that situation and learn that you can handle that situation. So there's a test in the sense that I wouldn't consider it to be a full ERP experience. And many people will then, by doing testing, think, oh, I'm pushing my luck here. I really shouldn't do this. And that might lead them to pull away more and more, when the reality is we want them to move toward, not move away. Sometimes people ask, can't I just do a small safety behavior? Well, I have issues with that, because safety behaviors become the things that people attribute their safety to, no matter how big or small it is. So if you're labeling something as a safety behavior, my goal is to get you to eliminate that, because what happens if one day you're not able to do that safety behavior? Then you'll think, well, here's the day. The bad thing is now going to happen because I didn't do the safety behavior. You know, it's kind of like if somebody with panic disorder relies on a as-needed medication for panic and gets to work and realizes that they forgot to bring their medication with them that day, I can pretty much guarantee they're going to have a panic attack that day. Not because it's different than any other day in terms of their body or panic, but more in terms of they're likely going to spend the day thinking, oh my gosh, I don't have my meds. What if I have a panic attack? Which is just going to get them so riled up that it increases the chances of them having a panic attack. And then I've even had people call me and say, would you believe the day I forgot my medicine is the day I have a panic attack? And I'll say, yes, I believe it. And this is why I haven't wanted you to carry that around with you all the time as this rescue experience, because you attribute the fact that you haven't had a panic attack in 20 years to the idea that you have that with you. That being with you isn't what stops the panic, right? You having that is a safety behavior, and you think I can't have panic as long as that's there, and then it doesn't happen. But now the day that you don't have it, well, guess what? You got yourself all riled up and all worried about it. I'm not at all shocked that you had a panic attack. So I want the elimination of this. Just like when we work with our brothers and sisters in the drug and alcohol community who might say, but today's a really rough day. Couldn't I just have a drink? I would not say, you know what? You're right. It's a great day to have one because it's been a really rough day. No, that is not what we do. In fact, those are the days it's essential not to have a drink to really learn I can get through life, even the most difficult experiences, without using drugs or alcohol as a way to do it. And that's exactly what I want for obsessive compulsive disorder treatment as well. I want you to get through life without needing safety behaviors to help you get through life. You can do it without them. Another question, how does exposure therapy work with moral scrupulosity and confessing? Well, confessing can definitely be a compulsion for sure. There are many people who will go up to someone and confess to them something and watch their expression, watch how they react. And if the expression isn't terrible and the reaction isn't bad, then they'll think, okay, it mustn't be so bad because they didn't react to it so much. So I guess I'm in the clear. And the more that you do that, the more you're going to have what I call an external conscience. I can only know if what I do is good or bad or right or wrong, or however we want to judge that, based on the way others react to it, because I can't trust my own judgments in any situations whatsoever. I want you to be able to trust your own judgment. I want you to be able to sit with the discomfort that you might have about something you've done and not have to go to run to multiple other people to run it past them to see what their thoughts are. You know this already, but even if you had 100 people in a room and you said to all 100 of them something you did, and 99 said, it's not a big deal, but one said, well, I mean, it might not be great, you're going to beeline to that person and say, you, truth teller, tell me more about what you say. Obviously, these 99 people who tell me it's fine are lying to me. You are the only one who really listened and who has the truth. Can you tell me why it's bad? That way I can do compulsions in order to try to neutralize it more to make sure that it doesn't come back to haunt me. And that's not what we want. We want people to sit in the discomfort. And I don't even like saying sit anymore. I like to really talk about living with the discomfort. Go out and live your life, even if there's discomfort there, even if there's uncertainty there. I'm going to bet this. You already live in uncertainty and you don't even think about it. If you drive a car, you live in uncertainty. If you walk up and down stairs, there's uncertainty. I'm betting you're not doing compulsions about those, but you might be doing it about other moral things. If that's the case, why is it okay to have uncertainty here, but in this one teeny tiny little area, I must have absolute certainty, and that's the only way it can be? Why? Because that's what OCD does. Keep this in mind as we're going through all of these things. OCD is nicknamed the doubting disorder. It's common that it will keep asking questions and come up with more and more scenarios to try to get you all tripped up. But here's the bottom line. If you're living with OCD, you can get better. And it's far easier to access effective treatment today than it ever has been before in the entire history of therapy. Decades of studies have shown that people who get the right sort of treatment can learn to manage OCD symptoms and truly live life again on their own terms. So go to NOCD.com. Schedule a free 15-minute call with our team. We're excited to talk to you, and we will ask you about your symptoms, and we will match you with one of our trained, licensed OCD therapists in your area. They're going to work with you to help you create a custom and personalized treatment plan. We want you to start feeling better as soon as possible. We want to be sure, again, that you are in the driver's seat and not OCD. So get to the life that you want to live and not the one that OCD wants you to live.